We are still seeing very high case counts from the coronavirus here in Philadelphia, and we are seeing increases in the severe consequences of this infection. So everyone needs to be very careful during this next period of time to stay away from others. Here are the numbers. Since this time yesterday, we've identified 1,077 new cases of the coronavirus in Philadelphia residents by the PCR test, the standard test, bringing us to a total of 61,780 since the beginning of the epidemic. In addition, we've identified 45 people who are considering probable cases based on having a rapid antigen test only. Now, for the past week that ended on November 21st, we averaged 765 cases a day of the confirmed coronavirus infection. Now, so far, that's a decrease from the 888 cases per day the week before, but those numbers are still, for last week, are likely to increase with delayed reporting. We do know there are delays for us getting results from the laboratory. Among people that were tested last week where we have the results, 11.8% tested positive. That 11.8% is the same as the week before. So at least there's one positive thing here, and that is that percent positivity did not increase last week, and it's been increasing steadily from week to week before then. So there is some leveling trend here. A leveling trend could just be a pause before we see another increase. It could be the beginning of a reversal. No one telling right now. But even so, the number of daily cases we're seeing is still extremely high, and we're seeing the consequences of that. That's what's happening here in Philadelphia. And what about the region around us? We're still seeing very high cases everywhere around us. The state of Pennsylvania is reporting more than 6,000 cases per day. The state of New Jersey, more than 4,000 cases per day. Back here in Philadelphia, we're particularly concerned and watching our nursing homes. We are seeing more cases and more clusters in our nursing homes right now. That's particularly worrisome to us. In nursing homes, there were, for the week that began November 8th, we had a total of 84 cases in residence. And for last week, we have 52 cases reported to us so far. Both of those are a big increase from the 10 to 15 cases per week that we saw in August and September. Now, staff of those nursing homes and staff that are going to help those people in those nursing homes are trying very hard to contain the spread of the infection in those facilities, but it's not easy. Right now, we have 42 nursing home residents who have been transferred to the city's COVID relief unit. That is a unit specifically for nursing home level residents who have positive cases for COVID or have COVID infection, where it's safer to have them be there than to have their own regular facility to protect the people who don't have COVID in their regular facility. What about hospitals in the city? Well, the number of people who are hospitalized with COVID is growing here in Philadelphia and in the state as a whole. The state's database on hospitals is reporting that the Pennsylvania hospitalized COVID patients is rising rapidly. It was more than 3,400 patients yesterday. For comparison, just last Thursday, it was 2,900. And both of those are new highs. They've never been this high before. Now in Philadelphia, as of this morning, we had 672 patients who were hospitalized with COVID. That's up from 542 last Thursday. The numbers are still rising, but to put in perspective, we peaked at about 1,000 cases last spring. So we know that we can handle 1,000 cases, but again, those numbers right now are rising. So we can handle this now, but I'm still concerned about that the hospitals may come under strain if we don't get this particular epidemic wave under control. What about deaths? Since yesterday, we've identified 7 new deaths from the coronavirus in Philadelphia residents, bringing us to a total of 1,960 since the beginning of the epidemic. Now, for the week of November 8th, by the date of death, we had 31 deaths. And by the week of, for the week of the start of November 15th, we've had 17 so far, but we know there's often delayed reporting on deaths, so we expect that number to rise. Both of those are a substantial increase from the 10 deaths per week we saw in September. So that's where we are with the severe consequences. Now, as far as testing goes, we are seeing a big demand for testing right now, a big increased demand. We think a lot of that is people who want to be tested before they travel for the holidays. But because of that, some of our testing sites are hitting the limits in how many people they can test. They're doing what they can. They're moving through the people that they can, but they are setting some priority. It's a higher priority for the testing sites and for the city as a whole to test people who have symptoms and to test people who have been exposed to COVID. Those are people who are more likely to be positive. We want to identify as quickly as possible to contain the spread from them. I just remind people that last Friday, the restrictions that we announced, our safer at home restrictions, went into effect. Remind people what they are. They are no indoor gatherings, no indoor dining, restaurants, no indoor sports, No gyms, no museums, no libraries. As far as retail stores, we want to be very careful. Retail stores have to enforce that people need to wear masks. Stores are responsible for that. There's also a limit on the number of people who can be in stores, 5 per 1,000 square feet. The health department will be sending teams of people starting today to visit stores to educate them about these requirements. But in the end, much of this is really going to have to fall on stores to enforce this reduced density for the safety of their customers, as well as for the safety of the city as a whole. Outdoor activities under our restrictions are allowed, but they're with lower limits than we had before. And there's detailed guidance on all of our restrictions at www.phila.gov/safer-at-home. Now, yesterday, the governor announced new restrictions for the state of Pennsylvania. Those restrictions include a strengthening of the mandate to wear masks in the state as a whole, a requirement for people to work from home unless it's impossible for them to work from home. That wording, unless impossible, is stronger than the wording in the city's order about working from home. The governor's order also includes reduced density for gatherings, indoors and outdoors, and requirements that public schools in high incidence counties either attest to their following certain safety precautions or to go online only. Now, for other than the remote work requirement, the city's requirements are consistent with or more stringent, more restrictive than the state's requirements. I just want to be clear that for people in the city of Philadelphia, they have to follow the more restrictive requirements. They have to follow the city rules. People outside the city of Philadelphia and suburbs, they have to follow the state rules. Again, people have to follow the more restrictive rules. Then on a more positive note, let me talk a little bit about where we are with vaccination. We now have 2 vaccines that, by report, have been shown to be more than 95% effective. The first of those vaccines is under review now by the Food and Drug Administration. We hope that the Food and Drug Administration will conclude that the vaccines are effective and safe. If that first vaccine is, we are likely to start vaccinating here in Philadelphia in mid-December, maybe less than 3 weeks away from today. Now, our first allocation of vaccine from the federal government will give us a limited number of doses. And our first top priority group will be healthcare workers who are routinely exposed to COVID, such as hospital nurses that treat patients with COVID, or people who work at the COVID testing sites. We don't want to get those people infected, both for their own sake, but also so they don't pass the infection on to their patients. As we get more vaccine, we're going to be widening the criteria for who can be eligible for the vaccine. That's where we are today. Now, what should people do? Just to remind everyone now that we're seeing very high rates of infection, and we are seeing the severe consequences of such high rates of infection. So right now, it's important for people to say you're safer at home. Stay at home as much as possible. It means work from home unless it's impossible to do so. Don't go to the workplace. And stay away from others unless it's necessary. Now, as Dr. Haidt mentioned, as the mayor mentioned, we are all very concerned about family gatherings at the upcoming holiday. We've given people plenty of warnings that they should have a Thanksgiving meal with their household members only, the people they're exposed to every day. But there were warnings over Halloween. We still saw a spike in cases afterwards from Halloween parties. So I want to reiterate again, please celebrate Thanksgiving only with the members of your immediate household. You don't want to spread COVID to your elderly grandmother or to that cousin of yours that may have a chronic medical condition that might make him severely ill if he got the infection. Now, if you have to go out, for example, you want to exercise, that's fine. Stay away from others. And when you're around anyone, anywhere, who's not a household member, make sure you are wearing a mask and make sure that they're wearing masks. Now, these next 6 weeks between now and the first of the year are going to be very difficult. We recognize that. But we are, in the big picture, close to the end of this. We've been through this for almost 9 months now. I'm very optimistic of where we're going to be in 2021. However, we need to get there safely. If we act responsibly now, we can save many lives over the next few weeks until we get to the next phase where vaccine is available. More information on all this is on our website, www.phila.gov/COVID. Thanks.
Yeah, hello. 2 questions for Dr. Farley and then one for the mayor. Dr. Farley, a group of gym owners, a coalition of gym owners, had a workout today, apparently at the MSB. They think that they could, they'd like to know whether, if they could come up with a different set of protocol, if they might be able to reopen prior to the 6 weeks. Do you see any way gyms might be able to reopen prior to the 1st or 2nd of January?
I don't, Jeff. There's no question that gyms do put people at greater risk. It's only 6 weeks. I'm sympathetic to the gym owners, but we do have human lives at stake here. And so I think people can exercise outside during that 6 weeks. I will say, because I'm sympathetic to gym owners, I should ask people who have gym memberships, keep paying your gym membership monthly fee so that the gyms can stay afloat during that 6 week period.
Dr. Farley, on testing, you said that that it's getting more busy and that you want to lay out priorities. Are you opposed to people testing to travel for the holiday?
We're not generally recommending that because we're concerned that there may be too much demand that we can't meet, and we do think the other people are higher priority. If people are going to travel, there is some value to that, but I haven't been enthusiastically promoting that because of that concern that there are lower priority and there's only so much testing we can do. Our recommendations in general are don't travel for the holidays, stay here and just have the meal with your immediate household members.
And for the mayor, I think one of the difficulties of this Thanksgiving, of course, is that some people won't be able to see, in fact, their adult children who are younger, maybe less susceptible. I think you have children. Mayor, how will you celebrate the holiday? How will you be with loved ones or have any contact with loved ones who don't happen to live with you?
Well, I had this situation with my mother who's 80, and I was trying to figure out how to tell her that I wasn't going to be able to come over. I didn't think it was good for her, and I have a nephew that has some issues with immune deficiency, and she texted me over the weekend and said, "I think it's a better idea that you don't come." She said, "It's only a dinner. We can have dinner another time, and I'll just hang out with my fiance and have quiet dinner at home."
Mayor, don't you have a child? I mean, don't you?
Yeah,
have
my children spend their not that it's your business, but my children spend the Thanksgiving holiday with their mother, and that's been that way for a while.
Thank you.
Let's go to Rosemary Connors of NBC.
Okay, great. Let's see.
You're up.
Okay, great. Thanks. Yep. My questions are for the mayor. And to be more specific, this is about the Philadelphia Fitness Coalition that did do this outdoor workout. If you're unaware, this coalition is made up of 30 plus fitness studios. So small group classes, like maybe 4 people in a class. It's not come and go as you please type of a gym situation. So that's who is out there protesting this morning. The Philadelphia Fitness Coalition says their data shows, and they did do tracing and tracking, no transmissions, that they are not happening in their spaces, and they want to know why they're closed down. What can you tell them?
Because for the entire time of this pandemic, I have been following the advice of public health professionals, and that's what I'll continue to do. All due respect to them and their data and their tracing, they are not public health professionals. And our public health professionals tell us this is the best thing to do to keep people safe. And again, as Dr. Farley said, I do understand their concern and their disappointment, but I'm following the public health professionals and their guidance.
In the beginning of this news conference this afternoon, you say that you support small businesses. Have you engaged with this community? Have you talked to members of this fitness studio community? Not specific.
I've had input from various folks, both in this community and others, but I understand the impact it has on business. But if the impact your death has on yourself is pretty substantial and pretty long lasting, and as more people we can keep from getting sick or dying, I think that's really the paramount issue here.
Final question for the mayor. Okay, so if these fitness studios and gyms are going to be closed for 6 weeks, which could mean the death of their business, is relief funding coming? Does the city have a plan to help them?
The city does not have money to provide for every business that's affected in the city. That should be coming from the federal government. It should be coming from the Congress of the United States.
But it's not.
Well, I understand that. We don't have it. I have a $750 million deficit and a $650 million school district deficit.
Can you be lobbying for it?
Yes, we are lobbying for it. And hopefully with Vice President Biden, now President-elect Biden, and hopefully we pick up 2 seats in Georgia, we can get some sense back to our government and get some help back to people.
Thank you.
Thank you, Rosemary. Let's go to Sean Walsh of the Inquirer.
Thanks very much. Dr. Farley, I was hoping you can clarify something that has been confusing, I think, to some readers about the rhetoric about how small private gatherings have been fueling the recent increase in cases. Do we know that for sure? Because we've seen some epidemiologists who said that the data doesn't necessarily support that, or it's that as well as the things like indoor dining that we had talked about previously. How confident are you that the recent surge is primarily because of small private gatherings?
I'm not sure I can say primarily because I can't put a number on what fraction of the increase it's related to. I can tell you that it's very common in our case investigation and contact tracing interviews to learn about spread in small gatherings. So I do think that they're important. I can't say that they're more than 50%, but I absolutely think that they're important to spread right now. So I did see that article and I disagreed with the people who quoted that article.
I see. Okay. And as more broadly, are we implementing these since a lot of the business restrictions we just implemented don't have to do with small private gatherings? Is this just kind of not necessarily a bad way, but to throw everything in the kitchen sink at it because contact tracing isn't working out, that we're doing all these different restrictions? Or do we know for each of these, specific reasons why we're shutting them down?
We're doing a number of restrictions, trying to have them be the minimum possible in order to really change the trajectory of the epidemic, which would otherwise kill, we estimate, hundreds or perhaps 1,000 people before the end of the year. That's an awful lot of deaths. We have a model, we have models, I should say, in Europe where they have restrictions very similar to these and their epidemics turned around quite quickly. And so we do think that this would be enough. But this is much less than what we did in the spring. So, I understand people being affected by this, being unhappy about that. But I do think we need to recognize how many people are dying and potentially could be dying. And that this kind of step for a limited period of time, saving them seems to me to be worth it.
Thanks. And lastly, for the mayor, could you comment on reported plans by at least some members of the Mummers to hold some version of their usual?
I can't comment on that because I don't know who made the comments, the anonymous comments to another reporter. There are literally thousands of Mummers, and 2 or 3 men or women telling a reporter something doesn't mean it's going to happen. I suspect there'll be some activity down in the 2nd Street area where most of the clubs are located. But I don't expect any really organized group of people to do anything, because when the parade was canceled, they knew that they didn't have to buy materials for costumes and rehearse and do all the things they do to get ready for New Year's Day. So they won't be prepared to go out, and you may have some stragglers, but I don't sense it's going to be a problem.
And
all right. Thank you, Sean. Thank you, Sean. We are very short on time, and we have a lot of folks with hands raised. As I indicated by text, we're not going to have time for a second round today, but we'll try to squeeze in all the folks who have their hands raised. Now let's go next to Jack Tomzik of Metro.
Yes, this question is for Dr. Farley. In the spring, the Leah Core Center was utilized as a sort of field hospital. Is the city planning to set up another surge hospital space?
We don't have any plans to do that. What we found in the spring was that a greater need was for people who are nursing home level care who had COVID to be treated. We realized that if we set up a facility that could do that, we could transfer some of these patients who were taking up hospital beds into that facility, and that would free up those hospital beds for people who are more severely ill. And so that's what thinking led us to develop the COVID relief unit. And the COVID relief unit seems to be working as we expected. So we're hoping that'll protect spread in nursing homes as well as keep the hospitals from getting overrun, and that may serve it more effectively than what we had in the Leah Core Center.
Okay, and with the new restrictions that were imposed Friday, have there been any violations, any businesses that remained open or operated against the violation or against the restrictions?
Our environmental health team has, on a fairly routine basis gone out and found places that were not following the restrictions, even from before restrictions as well as, I'm not sure if since, because it's only been a few days. It's been fairly common to find places that are not wearing masks and otherwise not following the rules. So I expect there will be some, but I'm hopeful that most of the facilities in the city will be responsible and try to protect the residents.
Yeah, and something I've heard from some readers and just people around the city, they're saying, well, I'm safe, I wear a mask, I'm at home most of the time, all my family members are, why can't we get together? What would you say to that? People say, oh, everyone in my family is safe, we don't do anything risky.
I would find it unlikely that any group of 5 people or 10 people doesn't have one person who's been out there exposed to somebody else. And everyone should wear a mask, but even masks aren't perfect. So if you're out there interacting with other people, you're at some level of risk. And getting people together over a big meal is a very high-risk situation. So I would strongly request people don't do that.
All right, thank you, Jack. Let's go to Martin Pratt of Philly YBN.
This question is for Dr. Farley. Dr. Farley, have you seen the report from China that was released in September that stated that about 39% of people who wear eyeglasses don't get COVID? They saw that a huge increase of people who don't have any kind of eye protection getting COVID in China. In light of that report, would you suggest that we all start adapting face masks, eye shields, versus just the mask?
Yeah, I saw that study and I thought it was an interesting study. It does suggest that maybe the viral particles are being splashed in people's eyes, or the droplets in the air may be getting into people's eyes, and there may be some value to glasses. It's just one study, though, and one study that potentially have some biases to it. There haven't been other studies that have confirmed that, and national bodies are not recommending face shields for everyone. So we're not changing our recommendations now. I do think it's interesting. It's something we just need to have a little more research on.
The second question I have, and this is the last question, can you explain a little bit of what we're seeing in long-term issues when it comes to loss of the sense of smell and how the virus affects the cells inside the nasal cavity that goes to the brain? Because I think that people aren't really understanding it's not just surviving COVID. It's actually after you get COVID, French fries smell like garbage, and all these other smells that we're used to. Coffee smells like rubber burning. So can you explain a little bit about the loss of a sense of smell?
Yeah, so there's a lot about this virus that we're still learning because it is still new. And most people get over this infection fine. Some people get a severe infection, and some people seem to have long-lasting consequences. I don't know the details of that, but I can certainly, of what your question is specifically, but I can speculate that our smell is done through our respiratory tract, the same part of the body that the virus infects, just like the lungs. And there are cells in there that absorb chemicals that then we recognize through the brain. And if that lining is interrupted by inflammation because the virus is there, then things are going to smell different. You may not be able to smell at all. So that certainly happens during the acute infection for people. And it sounds like by a report for some people, there are changes that are last a while afterwards.
Okay, thank you, Martin. Let's go to Danya Henninger of Billy Penn.
Hi, thank you. I guess this question is for Dr. Farley. So there's a disparity. Some people think there's a disparity between your recommendation to just stay home and the fact that there's a very public, city organization, I think Center City District run flea market around City Hall and Love Park. And so, it's outdoors, understand that there's outdoor dining, but it's like stay at home, but yet the city is throwing this big festival that says come out and do ice skating and things like that. Could you talk about that disparity in messaging?
Yeah, this festival is something that's done every year. It was planned well in advance of what we announced just a couple of weeks ago. And we had a choice to say, well, should we just cancel it entirely, or should we put in place restrictions? And in view of the fact that it's outdoors and that we could put in place restrictions, we felt probably we could do this fairly safely. If it were indoors, we would have canceled it. So yes, we're not saying you must stay at home. This is not like we were in the spring where really we're saying everybody's got to stay at home. We're really encouraging people to stay at home as much as possible. But for this, given the large city is still a relatively small gathering, we didn't think that it would make sense to cancel it because it was outdoors.
Okay, a lot of other things are canceled, but sure.
There
So
are many things that are outdoors that are outright canceled.
got it. My other question is just kind of a follow on Martin's question about are there any, the when you survive COVID and the problems that happen afterwards, is there anything that we're tracking in Philadelphia about that? Like, do you know, we've read studies from elsewhere, like hard to exercise after you've had COVID, even if you feel fine. Do you know of anything locally, or are you tracking it at all?
Yeah, the health department's not tracking that because our main job is to try to prevent people from getting infected in the first place. So we're kind of interested in what happens right up until someone gets infected, but the long-term consequences are not so much our responsibility. That is some responsibility of the medical care system. There may be studies being done by some of the researchers in the health centers in the city, but we in the health department are not tracking that.
Thank you. All set.
All right. Thank you, Danya. Let's go to Kennedy Rose of the Philadelphia Business Journal.
Hi, I have two questions for Dr. Farley. First, I was wondering, why is the health department sending out representatives to educate retailers about restrictions now? Is there any sort of urgency because of Black Friday and Small Business Saturday?
Well, we sent them out because we put in place the restrictions last Friday. And this is as quickly as we could put together a team to go out there. It wasn't specifically related to Black Friday. It was really related to the timing of the restrictions.
Okay, and how many people are on this team, and are they targeting any specific business corridors or any type of stores like grocery stores, small retailers, big box stores, et cetera?
The team today is 10 people, and they're somewhere in Center City. I don't know the details. And we will continue that, and they will probably move around the city over time.
Okay, thanks very much.
Thank you, Kennedy. Let's go to Kristen Johansson of KYW.
Hi there. This is for the mayor, for Dr. Farley. So there have been studies about how safe it is to fly if you have a mask on. There's limited, like COVID, I guess, that comes into your airspace. Gyms obviously are different than restaurants because restaurants you can't have, you have to take your mask off, obviously, to eat or drink. So with gyms having masks on, what study are you looking at when you make the decision to shut down gyms?
Well, first, let me just point out that people aren't always wearing masks in gyms. Many people are uncomfortable wearing a mask when they exercise, and so it's difficult to enforce mask use. And we saw an example last week in that article from Philly Magazine of a gym that had lots of people who were not wearing masks. But then there is evidence from elsewhere that gyms are simply high-risk settings, probably to a certain extent because people are not wearing masks, and also probably to a certain extent because when you breathe heavily, you're putting more respiratory droplets out and getting more in. So the state of Minnesota tracks outbreaks, and gyms are among the more common places where they see outbreaks. And then there was a study that was just published a couple of weeks ago that looked at 10 cities across the country, including Philadelphia, and showed that gyms were important sites of community-wide spread, or important sites that promoted community-wide spread of the virus. So, people may say theoretically we're not going to have any risk there, but just the reality is that there is a risk in gyms.
And who did that study, just so we can look it up?
It was published in Nature.
Okay. And my second question is, with so many precautions in place, I guess this is for either for the mayor or for Dr. Farley, with so many precautions in place, discouraging people from gathering, why has the Christmas Village been allowed to continue to happen with people eating and drinking and shopping? I know you did speak about it before, but there's a lot of people that are, if you look out in the ice skating rink, there's people kind of crowded all around together. And then also, how is a Christmas Village different from other catered gatherings that have been restricted?
The Christmas Village is outdoors. We make a big distinction between outdoors and indoors. And there's a restriction in the Christmas Village as far as the density of the people there and the limits on how they can serve the food and how they can eat the food there. We had our inspectors out there yesterday and setting things up, putting limits on that. So it's along the lines of outdoor dining. Now, as far as outdoor gatherings and events, such as weddings, lots of opportunities for spread there. In those settings, people know each other. People mingle across tables with each other. Whereas at a setting like outdoor dining, or in this case, the Christmas Village, people are generally not interacting with people at other tables. They're strangers from people at other tables.
Okay. That's it for the question, but from a lot of the pictures and videos, if you go outside, there's like 50 people on the ice skating rink and a lot of people mingling with each other. So we're just trying to figure out what the difference is for restricted gatherings, outdoor gatherings versus the Christmas Village.
I'll have to
There is mingling.
I'll have to look at the ice skating rink specifically. What protocols I looked at were for the Christmas Village itself.
We don't have a Christmas tree lighting this year. We've done that remotely. It was filmed last night. So we're not bringing all those folks together, even though it's outdoors, because they tend to congregate around the stage and a live performance. And we've taken that precaution to keep too many people from gathering in one spot. As Dr. Farley said, you don't have to stay home, but you have to be distanced. And we believe that these regulations are putting people in the right distance and with masks on. I mean, you can go to every single example. I mean, we could be here forever going from example to example. This is what we think, based on the science and the medicine, what is the appropriate thing to do at this particular time. It could change, it could get stricter, it could get more loose after 6 weeks.
Okay, thank you, Kristen. Let's go now to Mike Donofrio of the Tribune.
All right. So I guess this is a question for Dr. Farley. Let's see here. All right. So you said you're seeing worrying case counts throughout the city, but what about Black and brown communities specifically? How are these communities being affected by this new wave? And are you seeing strains on testing sites specifically in those communities?
We are seeing increases in cases in all populations. I did look a week or so ago, and it seemed to be that we were maybe seeing higher increases in African Americans and other groups. That the groups that have higher rates has changed over time during the course of the epidemic, one way or the other. In general, though, people who are less fortunate, people with lower income, are more likely to have severe disease here. So certainly every group is at risk, and we are particularly concerned about groups that are at less advantage.
And then just lastly, are you, I guess, is the administration taking any new steps during this new wave to help those communities that it hasn't done previously?
Well, just say we're doing everything we can to try to blunt the epidemic. That's what these restrictions are about. We're also putting a special emphasis on those sites where people die from this, such as nursing homes. We can't be in every neighborhood at every time, but everything we can think of, we are putting in place right now.
Okay, thank you.
Thank you, Mike. And finally today, Manny Smith of CBS 3.
Just three quick ones from our team. First is COVID related for Dr. Farley or the mayor. We've seen the CDC and also Dr. Levine restrictions on people avoiding travel. Is the city planning on assisting or enforcement or any of those efforts, doing anything at 30th Street, bus station, PHL, as far as enforcing or encouraging the people not to travel?
There's no enforcement like that we have planned. I don't think it would be practical. I don't think it would be well received. We're simply recommending people not travel.
All right, cool. My second two questions are for the mayor. Today, Donahue Peebles, he's the guy with the family court building, says you guys canceled his contract unfairly. Any response to that?
I believe that the contract was about 7 years worth of wait. The potential for the development of a new hotel in the middle of this pandemic or shortly thereafter the pandemic is probably not strong. So we wanted to put it out again to see if there was an interest in some other use other than a hotel. And he's certainly welcome to reply again.
All right, cool. One last question from Stephanie Stahl is with me.
Hi, this is for Dr. Farley. Dr. Farley, a lot of people are trying to get tested and with a negative test feel they are somewhat safer to be with family members for the holiday. Can you address a negative test and how that is not necessarily 100% sure for safety for people to be around family members for Thanksgiving?
Yeah, Stephanie, thanks for that question, because a negative test can be a false sense of security. There's an incubation period, the time between when you catch the virus and when your test turns positive. It's generally 4 to 6 days, but can be up to 14 days. And so if you test yourself during that period, you'll get a negative test even though you have the virus, and you'll turn positive a few days later. So if you happen to test negative now, then by Thanksgiving, you may be positive and you may be infecting your relatives. But just because you have a negative test doesn't mean that you are not risky to others.
Manny, are you all set?
We are all set. Thank you guys very much.
All right. And thank you, everyone. That concludes today's COVID briefing. Have a safe holiday, and we will resume next Tuesday on December 1st. Thank you.